Good afternoon, everyone, and welcome to CurePSP's Ask the Doctor, session number 8. Thanks to everybody who's tuning in today via YouTube and Facebook Live. We hope that you're all staying safe, healthy, and Happy New Year to you all. My name is Joanna Teters, and I am the Community Outreach and Resource Manager with CurePSP, and I will also be the moderator of today's Ask the Doctor. As you all know, this pandemic has affected people on every corner of this earth and brought on so much suffering, sickness, and isolation. Seeing vaccines approved and being administered has been a very heartening thing to see and a real glimpse of light at the end of a very dark tunnel. But of course, we all have many pressing questions about the particulars of the vaccine, how and when we'll get it, and how it may affect us in our diagnoses. We are so pleased to have here with us today Dr. Lawrence Golbe, to talk with us about the COVID vaccine and how it relates to PSP, CBD, and related neurodegenerative disorders. Many of you have submitted important questions about this vaccine and how it will impact your lives, whether you are a patient or a caregiver. So thank you for participating in today's webinar in that way. Please note that this will be a recorded webinar, and the recording will be made available on our website in the next few days. The link will be provided in a follow-up email. A couple of quick things, an overview for the platforms we're using today. Please type your questions in the comments box or chat box of the platform you're using, whether it be Facebook Live or YouTube. And please feel free to use the chat box to interact with each other or post any questions that you might have or questions that might come up for you today. But please do not reveal personal medical info. The questions that Dr. Golbe will answer first at the end of his presentation today were submitted prior to the webinar. However, if time allows, we will do our best to take as many live questions as we can, live and on air. Lawrence Golbe is an emeritus professor of neurology at Rutgers Robert Wood Johnson Medical School in New Brunswick, New Jersey. It's also a center of care for CurePSP. He graduated from Brown University and New York University School of Medicine and did residency training at NYU Bellevue before joining Rutgers in 1983. He was acting chair of his department from 2000 to 2003 and program director of its neurology residency from 2003 to 2018. His research is in the clinical genetics, clinometrics, and epidemiology of Parkinsonian disorders. In 1988, he co-led the first studies of the prevalence and risk factors in PSP. He led the clinical portion of the project that in 1997 identified the first known Mendelian mutation causing Parkinson's disease in the gene for alpha-synuclein. He devised the PSP rating scale, which since its publication in 2007 has become the standard clinical measure and treatment outcome marker for PSP worldwide. His current research centers on a geographical cluster of PSP. He has worked closely with CurePSP since 1992, presently as Director of Clinical Affairs, Chair of its Medical Advisory Board, and a member of its Board of Directors. His hobbies include cooking, learning Italian, reading history, and leading a nonprofit devoted to academics at his high school in Englewood, New Jersey. At this time, I'd like to welcome Dr. Golbe to today's program. Thank you so much for being here with us this afternoon.
Thank you, Joanna, for reading that whole introduction.
My pleasure. Good to see you here this afternoon. Thanks so much for taking the time to speak with us this afternoon and answer these questions.
Well, it's my pleasure. This is always a lot of fun. This is one of the highlights of my pandemic existence, is helping educate people with PSP and their caregivers, family members, or even pre-pandemic. It was fun. So we received a nice number of questions submitted ahead of time. Most of them were not related to COVID or the vaccine, but since the announced topic of this Q&A is COVID and the vaccine, I'll start with those and then we'll get to the other ones. First of all, the main pressing question that I've heard, and it showed up in multiple questions that were submitted, is a caregiver of a PSP patient eligible for a vaccine, meaning early priority eligibility for a vaccine? Well, that would be nice, but nowhere have I seen that mentioned, a caregiver status mentioned in the press or in any of the registration forms that I've seen for a vaccine. Nowhere does being a caregiver count as conferring any kind of priority, unfortunately. Of course, nursing home personnel in institutions where there's a lot of elderly people or sick people, they do get priority, but not home caregivers. How do I get one of my husband's doctors to advocate for him to receive the vaccine in a timely manner? Also a frequently asked question. Well, famously, there is no overall organized way of distributing the vaccine in the United States. So, so there's no uniform way of trying to advocate for special circumstances. What I would suggest is that you ask the doctor if he or she has any kind of possible route, any kind of strings that he or she knows about and that they're willing to pull to accomplish this. You know, they may. And of course, the answer to that question is going to be completely different from one jurisdiction to the next, not to mention from one doctor to the next. So, so I would say start with the doctor, and I'm sure you won't be the first one to be asking that question of them. Okay, next question. This person, I'm not going to use their name, was recently in rehab following a hospital stay. She was administered a TB test. Now cannot get COVID vaccination for 4 weeks. Why? Okay, first of all, the TB test is a skin test with a needle. You know, it raises a little blister on the skin, turns red and hard if there is a history of exposure to TB. It doesn't mean you have TB, it just means that you've been exposed to it at some point in the past. And anyone who has a positive test then needs to get a chest x-ray or sputum sample or some other more definitive test before diagnosing them as TB and making them undergo the prolonged treatment for that. Now, what's the interaction of that skin test with the COVID vaccination? Well, this questioner said that the person is prohibited from getting the vaccination for 4 weeks after the skin test. Actually, the interaction goes the other way. If you've had a vaccination with certain live vaccines, the COVID vaccination, the ones that are available now are not live vaccines. By a live vaccine, I mean the actual virus that's been inactivated, but it's still live in the sense that it's intact virus. For example, the MMR, the measles, mumps, rubella vaccine, that is a live vaccine. Now, if you get that vaccine, you should not then get a TB test within 4 weeks after that. So it's the reverse of what this questioner was asking. And why should you not get the TB test after that? That's because the inoculation with a live vaccine can suppress the immune system in such a way that you can get a false negative TB test within a month after that. But I'm not aware of any relationship of getting a live vaccine after the TB test. I don't think that's a problem. And in any case, the COVID vaccines are not live vaccines. Okay, I hope you understood that explanation. Next question, does the spike protein have an adverse effect on the tau protein? No. The spike protein is, of course, the protein that is on those mushroom-like spikes that come out of the COVID virus that attach to our tissues, that allows the virus to attach to the tissues. And the tau protein is, of course, the normal protein. That's an important part of our brain cells, which forms these abnormal clumps, tangles in the brains of people with PSP and many other diseases. And there's no relationship between one and the other. So in other words, getting the COVID infection will not exacerbate the course of PSP. Now, of course, if you've got PSP and you get COVID, then you would have more of a problem than if you didn't have PSP and got COVID, because the difficulty with general body movement would be exacerbated by the fatigue and muscle weakness that the COVID infection causes. So it would be even more difficult than it would have been to, say, clear secretions or to eat. So yeah, the combination of those two diseases is more than the sum of its parts, but it's not a direct interaction between the spike protein and the tau protein. Next, are embryonic cell tissues used in the vaccine? Are they used in research and testing and the production process? Well, this question about embryonic cells, this of course relates to the abortion controversy. Many people who oppose the legal availability of abortions also oppose using aborted fetuses in to obtain cells that are then used in medical research or to produce or test or invent medications. And for many people, it's not just aborted fetuses, it's also fertilized ova that are left over from fertility clinics, because normally a fertility clinic will use the sperm cells to fertilize a large number of ova and use one fertilized ovum to implant into the woman, and the rest of them are spares. And then they'll use the spares, they'll give them or sell them to a medical research facility to use to for the purposes I mentioned, for making or inventing medicines. The answer is yes. The Moderna and the Pfizer vaccines have been developed partly with the use of cells from aborted fetuses. The cells aren't actually in the vaccine that you receive, but the cells were used to create cultures, to grow in a dish, to test the vaccine on, or to help produce materials, proteins that were used in the production process or in the testing process. Okay. Once I get the second vaccine and quarantine for 2 weeks, in other words, to let the vaccine take effect, to build up the antibodies necessary to protect. Once I get the second vaccine and quarantine for 2 weeks, is there a possibility that I can still be a carrier of the virus? Okay, well, this doesn't relate specifically to PSP. It relates to anybody. The answer is yes, because the vaccine protects us, our whole body, wherever the immune system goes. But the lining of the nose is still vulnerable to colonization by the virus. In other words, even after your body in general has antibodies and other immune cells that are floating around that have been alerted, that are ready to fight off the virus, the secretions that come out into the lining of the nose don't have very many of those antibodies. That's a slightly different kind of antibody. And so you can get the virus that's just living there in the lining of the nose and not causing any illness in you. But if you sneeze or cough, or I don't know, you can emit the virus from your nose into the air around you, and somebody else can breathe it in. And if they don't have the antibodies because they haven't been vaccinated, then they can get the disease. Okay, that's all of the COVID-related questions. The plan was to see if there's any COVID-related questions that have been submitted, and I would answer those before getting to non-COVID-related questions. I don't see any in the chat, so I will proceed. If you think of any COVID-related questions, just type them into the chat and I can get to them. Okay, first thing. What's the latest? Yeah.
We actually have a couple of questions that have come in just now, so I'd love to take a moment to cover one or two more, if you don't mind.
Sure, go ahead.
Alrighty. The first one that I have here is there a preference of which arm to get the vaccine? My husband has cortical basal syndrome and his right side was affected initially, and he has not used his right arm in 2+ years. He is no longer able to use his left hand now, but his left arm is not as stiff. Is there any reason not to get his injection in his right arm?
Well, that's a good question. In general, it's better to stick needles into an arm that can move better, because if there's going to be swelling as a result, a bleeding, swelling, or less likely infection, it's better to be able to move that arm around. It helps clear the infection. Generally speaking, they put it into the left shoulder because in most people it gives you a sore shoulder, and most people are right-handed. But in the case of somebody with CBD, the more mobile arm should be used.
Great. Here's one more. Would it be possible to get the vaccine being under 65? This is a complicated question. Have you heard of anyone with PSP having vaccine side effects from either Pfizer or Moderna?
Okay, two different questions. Well, getting it under 65, if you have a condition that would make the getting COVID particularly dangerous, and there's a list that's different from one jurisdiction to the next, then yes, that would give you priority. Eventually, I mean, the way the question was worded, it sounds like, is there any possibility of getting it at all? Of course, the intent is to immunize the entire population of every age. But as I mentioned earlier, if you're younger than 65 and you don't have any of the prioritizing situations, then you'd be in the same bin as everybody else. What was the second question?
The second question was, have you heard of anyone with PSP having vaccine side effects from either Pfizer or Moderna?
No. I received one report of somebody who received the Pfizer vaccine who had a more prolonged period of feeling fatigued and headachy and body achy and sore shoulder than would be expected, but only by 1 or 2 days. So no, it was probably just like any biological phenomenon, it's a bell curve. There'll be a certain number of people who have a more extreme version of anything. And so the answer to the question is no.
Great. What is the risk of getting COVID if you have longer than 4 weeks between the immunizations? So,
yeah, in other words, there's waiting more than 4 weeks between the shots. Does that increase your risk of getting COVID? I've been reading that it's looking like waiting longer than 4 weeks is okay. But there was a reason why they specified 4 weeks originally and not at least 4 weeks, because you don't want to let the benefit from the first one wane before the second one is given. Otherwise, the second one might not have as much benefit. But the jury is not yet in on how long you can wait safely. So keep watching the newspapers for that, and look at the cdc.gov website for advice on that. It's a very good website they have at the CDC, very clear explanations of everything.
Absolutely. And I also just take a moment before asking this last question that I have. On the CurePSP website, we have created a coronavirus resources page that not only includes important information and links to things like the CDC or the World Health Organization. We also have a advisory note that was written by you, Dr. Golbe, about the pandemic, and then also another one that was updated on the 15th of December that was about the vaccine. So please head over to the coronavirus resources page. That's curepsp.org/COVID, I believe. I think that's what it is. I'll double check and get back to everybody on that. And there is also a survey. If you do experience any side effects, we are collecting anecdotal evidence of any side effects in PSP or CVD patients who have gotten the vaccine. And we'll make mention of that at the end of this webinar as well. So here's one more. And of course, if you have other questions about the vaccine, you still have time to submit them, and we will do our best to get to these questions at the end of the webinar. But after this next one, we will jump into some general PSP, CBD, MSA questions. Lastly, if someone with PSP gets COVID, could it be catastrophic? Will the symptoms of PSP worsen, or only while COVID is live in their system?
Whenever anybody with any kind of chronic neurological disease or any kind of chronic disease develops some unrelated stress on top of it, the underlying disease will temporarily get worse. And the stress need not be an infection, need not be a medical illness at all. It could be a stress, a death in the family can aggravate somebody's diabetes. Even a good stress, like going to a wedding or a graduation or something, can aggravate the symptoms of somebody's chronic disease. Now, it doesn't actually aggravate the underlying biological severity of the disease. It just interferes with the body's ability to compensate. So if you have PSP or CBD and then you get COVID, yeah, I would think that your symptoms, your neurological symptoms would get worse, but then they would return to wherever they would have been after you recover from the COVID.
Wonderful. Thank you very much for taking the time to answer those questions. For now, I will leave you to answer some more of the more general PSP questions that came in prior to the webinar. But of course, if there's folks out there that have other vaccine-related questions, we will do our best to get to them by the end of this session.
Okay. A big piece of news about PSP in the last few weeks was the decision of the drug company UCB to stop or to not start their upcoming trial of an antibody for PSP. And the reason they gave is just that they wanted to concentrate on Alzheimer's disease, which is a trial that's already in progress using the same antibody. And why they wanted to do that rather than to concurrently test in PSP was just a financial one. They said because these trials are so extremely expensive, it was a business decision to concentrate on the Alzheimer's first. So they, I don't know what the chances are that the company will return to PSP if the Alzheimer trial is a success, or that they'll return to PSP if the Alzheimer trial fails. We don't know, and the company's not saying. Does that have any implications for other monoclonal anti-tau antibodies? That's what the UCB drug is an antibody directed against the tau protein. It may very well. There's just there's no way of predicting this. Different drug companies, they have complicated ways of making their decisions. Combination of medicine and business, and I wouldn't want to try to second guess what they're doing. As far as other types of treatments or protection for PSP, I would think if anything, it would be good news, because this means that in the next year or two, there'll be less competition for recruitment into trials and less competition likely in the market once the drug is approved. Let's find some other questions. Alternative therapy to slow progression. Alternative therapy, well, we don't have any mainline therapy yet to slow progression. So alternative therapy, I think, is intended here to mean therapy based on natural products. We don't know of any such natural products that might slow the progression of any neurodegenerative disease. Of course, there are natural products that can help the symptoms of Parkinson's, which were the mainstay for 100 years until levodopa came along. Any clinical trials for PSP on the horizon? Yeah, on the horizon, there are some things. There's an oral drug that helps prevent the tau molecule from tangling up. It's called, and it's in the class called O-glycanase inhibitors. Those might start up after the pandemic lifts. Of course, you realize that the pandemic has put a tremendous damper on any clinical trials, because the hospital space is being used for vaccine trials, and hospitals want to minimize the number of people coming and going into their facilities for the obvious reason. And there's, besides the O-glycanase inhibitors, there's a couple of drugs called ASO, which stands for antisense oligonucleotides. Sorry about the long terminology. These are drugs that have to be injected into the spinal fluid at the base of the spine, and it circulates up into the brain, and it prevents the tau molecule, or the abnormal form of the tau molecule, from being encoded by the DNA. So that may start in the next year or two. Next question, are there problems with a patient's vision as the disease progresses? Well, obviously PSP, the cardinal feature of the disease, and the one that produces its name, is the eye movements. So if you can't move your eyes well, then it's hard to see. I mean, it produces what I call a functional blindness, because you can be trying to look at something, but since your eyes can't really focus on the very point that you're aiming at, you get a degradation of the vision. If you've ever tried looking at some tiny point and just looking a fraction of an inch to the side, the point that you would have been looking at is a little blurred. That's because our focusing works best right in the middle of our retina. So since you can't point that spot of the retina directly at the target of interest, there'll be some blurring. Besides that, in PSP, very often there are these little horizontal movements of the eyes called square wave jerks. And as you would guess, that will degrade the quality of the visual perception. Sometimes there's blepharospasm, which is involuntary closure of the eyes, and obviously that will impair vision. But the actual sharpness of the image in the fovea, which is the high focus area of the high resolution area of the retina, that is not degraded by PSP as far as we know. Genetic testing update. Well, if by genetic testing you mean a test that your doctor can order to see if you have PSP, or to see if relatives of yours are at risk of getting PSP, we don't have such a thing yet. There is a commercially available test to sequence the gene that makes the tau protein. The gene is called MAPT. MAPT stands for microtubule associated protein tau. So you can get that sequenced. The thing is that the vast majority of cases of PSP do not have any mutation, don't have any variant in the MAPT genetic sequence that we know of. There have been about a dozen variants that cause rare forms of a tau disorder that looks kind of like PSP. It's called familial frontotemporal dementia. And so you can be tested for those, but if you don't have a family history of PSP, in other words, if you're the only member of your family that's had PSP, there's no point in testing for that. Now, maybe in the future, the genetic risk factors that have been discovered, in other words, the little variants in some genes that account for a very slight fraction of an increased risk of PSP, if those can be combined into some kind of a battery, maybe that can constitute a genetic test for PSP, but that's still a few years away. Next question. What specifically are you looking for in a donated brain of a PSP patient? Okay, that's a very good question. Well, for one thing, we're looking to verify the diagnosis, the clinical diagnosis. Even the best neurologists, the ones most experienced in PSP, the ones who go on the internet and answer questions about PSP, they can be wrong about a diagnosis. Obviously, I'm speaking from experience, and so that's one thing. And so what would be the problem? I mean, the patient, of course, is already deceased. What good would it do to know the correct diagnosis? Well, some things that can mimic PSP during life and lead to a false positive diagnosis of PSP, some of those things are of some significance. They might be hereditary things. So those, it would be good to know what those are, to be able to identify them with an autopsy. Another reason to find out the diagnosis is so that the brain tissue can be used for research. Obviously, you need to know the diagnosis in the brain before you can use it for research. And the way they process a donated brain is they slice it in half this way, and they use one half to make the diagnosis. It's preserved in one specific way with a certain chemical to allow the doctor to do that. The other half of the brain is frozen so as not to change its chemical structure, and that half is used for chemical research, for extracting DNA, for genetic studies, etc. All right. Has anyone tried stem cells for PSP? Yes, there was one trial. It didn't work. It was just a very kind of crude injection of stem cells into the arteries feeding the brain. This is not something that people should be trying outside of a formal clinical trial. Do not go to China or someplace like that, Mexico, and get stem cell injections for PSP, please. And it's not, and don't say, well, it can't hurt, because it can hurt. The patients who got these injections of stem cells into their arteries, they got little strokes all over from the blockage of blood vessels. Let's see. How can I keep someone with PSP happy and prevent them from leading into depression? What works for them and what doesn't? First of all, depression, yes, depression can occur in PSP, but not nearly in a majority of people. What looks like depression is actually a combination of several things. It's well, for one thing, there's some dementia, so that the person might have a hard time coming up with new thoughts, creating new ideas. That's what you get with frontal dementia, which is what you get with PSP, and that could reduce their verbal output and give the impression that they're depressed. Another thing that is very common in PSP, present in a majority, is apathy, where the person just doesn't really care what's happening to them. They don't care what's happening to other people. And that is also a mimic of depression. But having said all that, yeah, some people do have depression. And of course, there's also reactive depression. You can be sad from just having the disability. So what's the best treatment for this? Best treatment is probably social interactions. I know it's difficult for the caregiver to try to interact socially, have a nice conversation with the patient, do the best you can, but even better, try to recruit friends or somebody from a local senior center, or maybe just a neighbor to come by and, share a cup of something and just chat. Try to draw out the patient by asking simple questions. Just involve them in a social interaction. That's probably the best thing. If they can manage to play some kind of game, that would be great. Sitting and watching TV together does not count as social interaction. Is there any specific diet for a PSP patient? No. Malnutrition is a very major issue with PSP in the later stages, because the person has trouble chewing and swallowing safely, and so they end up not eating as much as they should be eating. So, a high calorie, high protein diet is part of the solution for that. Obviously, there should be an evaluation also of the swallowing function, because there are lots of things you can do to improve swallowing. You should see the specialist called a speech and swallowing pathologist. You can get a prescription for that from your doctor. You just call up the local hospital, ask for the speech department, and make an appointment. It's the same person does the speech and the swallowing. All right. Joanna, how much time we have left, you think?
Thanks, Dr. Golbe. Let's see. I think we have time for maybe 3 or 4 more questions, if that's all right with you.
Sure. Do you have any that you've received?
I do. And not too many having to do with the vaccine. So we'll stay on this same kind of general topic. We have a question about light therapy. Has light therapy shown to be effective in slowing PSP and CBD?
Light therapy? No, I haven't seen anything about that.
Any correlation of PSP in relation to MSA trials? Or do you have any comments about MSA trials in general? Let me just make sure our audience knows what MSA is. It stands for multiple system atrophy. It's a disease that is very similar to PSP in many ways. It's a Parkinsonian disorder like PSP, which means it has slowness and stiffness, a lot of balance problems, major balance problems, just like PSP. Also problems with speech and swallowing. Not as much eye movement problem. Not as much cognitive and behavioral problem, but the main hallmark of MSA is autonomic problems, the part of our nervous system that serves our automatic reflexes like maintaining blood pressure, heart rate, temperature, bladder, bowel. Those things are seriously impaired in MSA. Also, there's problems with breathing.
any trials going on there? Yes, there tend to be more trials with MSA than with PSP at any given time, possibly because anything that's used for Parkinson's will be used for MSA, because in MSA, it's not the tau protein like in PSP, it's the alpha-synuclein protein like in Parkinson's. So yeah, there are trials going on for MSA that use treatments directed at alpha-synuclein. There also are very often treatments directed at various aspects of the autonomic issues. So you should check clinicaltrials.org. And I think on our own website on CurePSP.org, we have updates on MSA trials.
That's correct. Yeah, and just to offer a correction, it's clinicaltrials.gov is the best website to receive up-to-date and current information on what trials are recruiting, which ones are active, so on and so forth. Are there any studies of blood transfusions having any benefit for PSP?
Yes, there has been one trial. It's not a blood transfusion exactly. It's young plasma. Plasma is the liquid part of blood without any of the blood cells. So in this trial, they took people with PSP and CBD and frontotemporal dementia. It's called a basket trial because they lumped all the patients in together with those various tau-based diseases. And they took plasma from young, healthy people and transfused it into the patients. Unfortunately, it didn't work. This is not some weird, Dr. Frankenstein, off the grid type of idea. This is a mainstream idea, and it's been tried in many other diseases as well by leading research institutions.
Thank you for that. Let's see, one or two more here. My mom spits up a lot of food, including water. We do chop and give her pureed food at times, but it continues to occur. Do you have any insight as to why that might be happening?
Well, when you say spit up, do you mean, I'm sure you don't know if they mean vomiting up or just spitting out from the mouth without having swallowed it first? Probably.
Let's hope that it's the second one.
The second one, yeah, that's what I figured.
Yeah.
With PSP, there's a couple of problems. For one thing, there's a problem with using the tongue to move the food or liquid to the back of the mouth to prepare it for swallowing. So if that happens, then that means the tongue is just kind of randomly moving around the mouth without really accomplishing the first step in swallowing, and the person may realize that and then just spit it out rather than have it sitting there uncomfortably. Another thing is the loss of inhibitions. Maybe the person is just kind of getting tired of swallowing, getting tired of chewing, and they're afraid to swallow. And so they don't have the inhibitions against just spitting something out. So that's what they do. Keep in mind that thin liquids are often the most difficult thing to swallow for somebody with PSP. So in somebody who's having trouble swallowing, instead of giving thin liquids, you should thicken the liquids using a thickener. And there's several different kinds. You can just buy them over the counter at a drugstore. Just ask the pharmacist for a liquid thickener. And also, you should be careful not to mix thin liquids with solids, like vegetable soup should be avoided, because it's very, very difficult for the person with PSP to deal with that combination of textures. Instead, use thickened creamy soups or blenderized purees.
Very helpful. Let's see. This is our last question for today. Would love to hear any comments from you on autophagy. Am I pronouncing that correctly?
Autophagy.
Autophagy, that's right. And its role in reducing the buildup of alpha-synuclein and beta-amyloid plaques.
Okay, well, in PSP, there's no alpha-synuclein or beta-amyloid plaques. The alpha-synuclein is in Parkinson's and MSA. The beta-amyloid is in Alzheimer's disease. But the question could just as easily be asked about the tau in PSP. So I'll answer that question. There's a lot of research going on right now about autophagy in PSP. And there are treatments being developed, including ones that may enter clinical trials in the next 2-3 years or so, that are directed towards various aspects of autophagy. Now, what is autophagy? Let me answer that question first. Auto means, of course, means self, and phagy, P-H-A-G-Y, means eating. So this is when the cell degrades components of itself as a way of disposing of unwanted components that are maybe overproduced or worn out or defective. And autophagy also is part of the natural development process. So if you can better regulate autophagy, you might be able to slow the progression of PSP. Has not yet been tested in humans, but it's a very promising area.
Wonderful. Please keep in mind that we will have future episodes of Ask the Doctor, and we are on a rolling basis taking your questions, and we will do our best to answer them in a future session. You can head to CurePSP.org to sign up for our next Ask the Doctor, which is going to be on February 24th, featuring Dr. Robert Hand, who is a wonderful physical therapist and has a ton of experience with PSP and related neurodegenerative disorders. So please tune in on February 24th for our next Ask the Doctor. But until then, thank you, Dr. Golbe, for taking the time to speak with us about the vaccine today and for sharing all of your wonderful expertise and wisdom about these diseases. We appreciate it.
Thanks to you, Joanna and Jacqueline, for arranging this.
Thanks to everybody for submitting so many wonderful questions for today's webinar. And like all of our previous Ask the Doctor webinars, this video will be archived on our CurePSP TV YouTube channel and on our website in the next few days. So please keep your eyes peeled for further communication. We are so thankful to all of you for joining us this year during our Ask the Doctor sessions. We've had the pleasure of hosting some of the sharpest and most cutting-edge neurologists in this field throughout 2020. So please go to our YouTube channel if you'd like to view previous sessions from medical professionals like Dr. Sklarov, Dr. Pantelia, and Dr. Scholes, in addition to much more important content, including Wellness Wednesday episodes. Lastly, these webinars and events are only available because of donations from viewers like you. So thank you all for donating generously to our organization. We appreciate you very much. Keep wearing your mask. Thank you all so much, and we'll see you shortly. Enjoy the rest of your day.